Hello everyone, welcome at SudhirEyeCoach, a channel for emerging and budding ophthalmologists. Today I'll be sharing a routine cataract surgery of phaco surgery where a toric lens have been implanted using the Verion Digital Marking System. As we all know, toric lenses are no longer considered premium in the true sense. After all, if we are considering spherical power, then why shouldn't we also correct the cylindrical power uh, when a patient has significant astigmatism? Generally, if the patient has more than 1 or 1.25 diopters of cylindrical error, we recommend considering a toric lens. Toric lenses help minimize the torsion of cornea, and as a result, the quality of vision in the post-ops is much better. To position toric lens accurately, we can use either the slit lamp marking manual systems or various manual marking techniques. Fortunately, we have two excellent digital platforms available at our hospital. One is Verion from the Alcon company and the Callisto from the Zeiss. Today I'll be showcasing a case where we used Verion digital marking system for the incidence placement and the intraocular lens positioning. The patient had a moderate cataract, roughly grade 3 nucleus, so phaco fragmentation was straightforward. The main reason I am sharing this case is to encourage those of you who may still be hesitant about starting with the toric lenses. It's not a difficult task. In fact, in the past, I have also shared comparisons with the manual marking systems and the digital one, and you can achieve a very good results manually as well if you prefer not to invest in expensive digital platforms. My intention of showcasing this case is just to give you encouragement that toric is not a big deal, and if you have the technology, if you have a good phaco machines, if you are competent phaco surgeon, you can start the toric lenses without extra investment. And it is also required, and it is also the right of the patient, because to get the best IOL in the eye, if the patient has high astigmatism, why not we can consider the toric lenses? Why to leave astigmatism again in the post-ops? So enjoy the video, and if you have any suggestions or comment, please feel free to share them. Also, if you have not yet subscribed my channel, please subscribe the channel SudhirEyeCoach. Please do so, and it definitely encourages us. And thanks for watching, and enjoy the video.